Well, obviously, we'd like to thank and welcome everybody who is joining us virtually today for our first virtual learning spotlight of the year. We're talking about strong hearts. We're talking about heart disease, cardiovascular disease, and why it's important, and of course, prevention. For those of you who don't know me, my name is Zach Stone. I'm an internist. I'm a primary care doctor in Hoover, Alabama, which is just outside of Birmingham. There's another. Um, so we'll get started.
Thank you.
All right. Well, just to kind of set the agenda of what we'll talk about over the next 20 to 30 minutes, we're going to kind of understand the basics of heart health, why it's important, and then we're going to talk about some of the major risk factors of heart disease and what we can do um, to prevent heart disease. And then we'll have some time for some questions and answers, I hope, at the end if anybody has any questions. So why does heart health matter, right? Why is cardiovascular disease important? The month of February, right? It's American Heart Month, right? It's to raise awareness for heart disease. It's the number one leading cause of death. It's the number one killer in the world, in the United States. About 1 in 5 deaths in the United States are due to heart disease, right? And over 2,000, the number I found, 2,500 people every day die in the United States due to heart disease, right? And many of this is preventable. When we start talking about these risk factors, you'll see that up to almost a half of all adults have at least one major risk factor. And we can modify those risk factors. We can do our best to prevent heart disease, delay heart disease, and that's our goal, especially in primary care. Right now, as it stands, it's estimated that about 1 in 20 of all adults have coronary artery disease. And that prevalence just increases with age, right? By the time you're 75, it's closer to 25%. So it's out there, it's prevalent, and it kills. So risk factors. So we don't know who's going to have a heart attack, but we know what those risk factors are and what we can do to control those risk factors. The ones on the right here, there's some that you can't control. Age. I wish we could do something about that, but we can't do anything about age. We can't do anything about family history. We get to thank mom and dad for the genetics that we're born with, and you can't do anything about the biological sex that you were assigned at birth. So those things are, the older you get, that's a risk factor. A significant family history, that's going to be considered a risk factor. Male, that's a risk factor more so than female. And those, there's nothing we can really do to control those. So we're going to concentrate on these ones on the left. And these are the risk factors that we can control. It's going to be smoking. It's going to be high blood pressure. It's going to be cholesterol, diabetes, obesity, and physical inactivity. And we're going to kind of dive into each one of these. It's probably nothing new, but we'll see what we can do to help reduce our risk of heart disease in each of these areas. So smoking, I think we all know by this point, right? Smoking is probably the most preventable cause of heart disease, right? It contributes to about 20% of cardiovascular disease related deaths. And even low levels of smoking, so 2 cigarettes, 5 cigarettes a day, significantly increases your cardiovascular risk. Smoking damages the blood vessels. It leads to increased inflammation, to atherosclerosis or plaque buildup in our arteries, and it increases the risk of blood clots. It reduces the amount of oxygen that gets delivered to the heart. It's nothing new. We've known for a long time that smoking is probably the most preventable cause of heart disease. So trying to avoid smoking, obviously, is the best thing that we could do. But if we already do smoke, then there is good news because you do see benefits when you quit. Our next slide. So if you do smoke and you decide, hey, quitting is right for me, then you get a lot of immediate benefits, right? Within 20 minutes after smoking, your heart rate and your blood pressure is dropped. Within 12 hours, your carbon monoxide levels normalize, which gives you better oxygen delivery. Within weeks, you already start getting early reductions in heart attack risk. Your circulation improves. I don't know, I'm going to read the entire slide to you, but usually by 5 years or so, your your coronary artery disease, it's reduced by 50%. And 10 to 15 years out, your risk of coronary disease is that of a non-smoker. So quitting is very significant. It definitely reduces your risk. If you quit at the time of your diagnosis, if you get diagnosed with coronary artery disease or cardiovascular disease and you quit smoking, you have a 44% reduction in risk of major coronary event, heart attack, stroke, things like that. So uh, we all know quitting is difficult, but you know, we got ways to help. So smoking cessation, number one. All right. So number two on the list is high blood pressure. Now, high blood pressure, 1 in 2 adults have high blood pressure, right? 50%. That's an outstanding number, and most people don't know it. Um, Blood pressure is, I mean, it's a silent killer. They call it the silent killer for a reason. It doesn't cause symptoms most of the time, unless you're extremely high, but most of the time it does not cause symptoms. You don't know you have high blood pressure. Most people don't know they have it unless you go into the doctor's office, right? Usually you're going into the doctor's office either for a wellness visit, an annual physical, or maybe you're going in there because you're sick. Somebody tells you your blood pressure's high. But high blood pressure is a significant risk factor, increases your risk of heart disease by 2 to 3 times, doubles your risk of stroke. And it really kind of, you'll see a theme here. It really highlights the importance of routine wellness visits or routine doctor's office visits so that we can look for these risk factors. Um, Controlling blood pressure, we know it reduces your car. If you have high blood pressure and you keep it controlled, which only about 25% of people who have high blood pressure can be considered controlled right now. But if you do keep it controlled, it reduces your risk of coronary disease or heart disease by 20 to 30%, 35% reduction of stroke, and 50% reduction in heart failure. So um, it's definitely one of the most things we can do from a primary care standpoint is help to control blood pressure. Um, High blood pressure just makes your heart work harder. It thickens the heart walls, the muscular walls of your heart. It damages the blood vessels. Um, how do we treat it? We treat it with lifestyle modifications. You're going to hear lifestyle modifications a lot. It's kind of a buzzword in primary care, but we're going to talk about lifestyle modifications and what we can do here a little bit later. And then also medications when needed is a powerful prevention tool. Next, we have high cholesterol. Like high blood pressure, cholesterol is not something in which you feel, right? You don't, the only time you feel high cholesterol is if you have a heart attack or a stroke. And I always say that's a bad time to diagnose it. So, high cholesterol doubles your risk of heart disease. It leads to plaque buildup in the arteries, which we call atherosclerosis. You really only notice or know if you have high cholesterol if you go get it checked, right? Go into the doctor's office, knowing your numbers. You'll get a cholesterol profile. You'll see the LDL, that's your bad cholesterol. Okay, that builds plaque in the artery. So higher LDL is bad. HDL is a good cholesterol, stands for high density lipoprotein. So HDL is a good cholesterol. It actually helps remove cholesterol from the bloodstream. So higher levels of HDL is good. Again, as with most things, lifestyle modifications, nutrition, activity, exercise, and then when indicated, medications. Lowering your LDL, this from a statistic standpoint, 39 points, you're going to decrease your risk of cardiovascular events by 20 to 25%. So um, definitely know your cholesterol, know those numbers, and work with your primary care provider to help lower those numbers, whether it involves medications or just lifestyle modifications. That depends on the person. All right, diabetes, another big risk factor. So if you have diabetes, you're 2 to 4 times more likely to develop heart disease. And not only are you more likely to develop heart disease, but you tend to develop heart disease earlier and it tends to be more severe. Um, and that number right there, 2 out of every 3 people with diabetes end up dying from cardiovascular disease. That's a pretty significant amount of people, which is why we push so hard for prevention. Right now, about 1 in 10 adults have diabetes. And again, they don't all know that. If you wait till you become symptomatic to get diagnosed with diabetes, you've probably had it for about 10 years and just didn't know it. Early disease is asymptomatic. You pick it up with routine blood work. But high blood sugar over time, it damages those blood vessels, leads to inflammation, accelerates plaque buildup. The other thing you get with diabetes is diabetes tends to run, or is more commonly found in people with high blood pressure and high cholesterol. So you get this double and tripling effect of cardiovascular risk, and like creates just more severe disease, earlier disease. Somebody else wants in. It just, like, the kind of theme of this presentation emphasizes the importance of screening, earlier intervention, controlling or delaying diabetes as best you can with lifestyle modifications, and then when needed, medications. Especially nowadays, there's medications that can not only lower your risk of, or you can help you control your diabetes, lower your blood sugar, but independently lower your risk of heart disease. So, something to focus on for sure. All right, obesity. So from statistics, 42% of US adults are classified as obese, right? We could probably have an entire discussion on obesity, and part of it being whether or not the BMI is our best marker or best definer of obesity. But regardless of which way we do define obesity, roughly 40% of adults are classified as obese. And not only that, but about 1 in 5 children and adolescents are considered obese as well. Our excess body fat, it's related, it elevates inflammation. It's related to insulin resistance. It elevates blood pressure. It increases cholesterol. All these things help to elevate our cardiovascular risk, and it can basically double our risk of heart disease. Like I said, we could have a whole topic on obesity by itself. Obesity it's a sensitive topic to talk about. We know it's a risk factor, but many people truly struggle with long-term weight management. It's hard. If I were to say, hey, everybody here, raise your hand if you've struggled with maintaining a healthy or an ideal weight, or if you know or related to somebody who is struggling, we would all raise our hands. And so when we talk about obesity and we talk about risk reduction, it's important to know that we really got to be looking at progress, right? And realistic goals, and not necessarily just perfection. We're not just going for our goal weight. We're looking for progress over time. Realistic weight loss goals. If you drop in 5 to 10% of your body weight, if you're obese, significantly decreases your blood pressure, significantly decreases your cholesterol, your blood sugar, and your cardiovascular risk. So small amounts of weight loss can equal very big improvement when it comes to risk reduction. This is probably something I meet with patients on a daily basis. People who are trying to lose weight, who are trying to reduce their risk. We have a lot of tools at our disposal, and we're getting more and more tools that become more affordable over time. So, it's worthwhile, if you're having trouble, to talk to your provider, talk to your primary care doctor, and come up with a plan that involves, nutrition, that involves activity, and that may or may involve medications that can help us lose weight, help us lower that risk. All right, so we've mentioned and talked a lot about lifestyle changes, right? How do we treat high blood pressure, high cholesterol, diabetes, obesity? We talk about lifestyle changes, and what does that involve? Well, a lot of it is obviously nutrition. And so when we look at healthy lifestyle choices and nutrition choices, what we want to focus on, I don't like focusing on just strict diets because those are hard to maintain. What we want to focus on is getting good whole, minimally processed foods, right? Mostly vegetables and fruits and lean proteins. Rule of thumb, we tend to recommend, or I tend to recommend, half of your plate in any given meal be fresh vegetables and or fruits. Um, Whole grains, concentrate on whole grains, oats, brown rice, quinoa, things like that. What we want to reduce or minimize is ultra processed foods, right? They're just not going to be healthy. Sugar containing added sugar containing drinks or added sugar to foods. That's going to be your sodas, your Cokes, your sweet tea here in Alabama, juices. It's hard to lose weight. It's hard to control diabetes. It's hard to control all of these risk factors if we're drinking sugar containing beverages in large quantities. Replace bad fats with good fats. So don't, replace your trans fats, your saturated fats, replace those with olive oil, with avocados, with nuts, with seeds, with some of these healthier fats. Limit sodium, right? Especially if you have high blood pressure. Um, our recommendation is less than 2,300 milligrams a day, right? It's hard to remember, but it's really hard to understand how much sodium is in the food that we eat. It's not usually just the salt that you put on top of your food at the table. It's the amount of sodium that's already in it. You really need to look at some of the food labels to understand how much sodium is food. I went to the grocery store and I looked at a can of green beans thinking, hey, it's a vegetable. I looked at the can of green beans had 1,700 milligrams of sodium. You're almost at your daily amount with just that. I read a statistic that the average American diet has somewhere between 4 and 6,000 milligrams of sodium per day. And so, especially if you already have heart disease, if you have high blood pressure, you really got to watch that sodium um, and look at those food labels. Mediterranean diet is the one that I recommend people the most. People who want, I want to look at a diet. I want to be able to research a diet. I want to look at websites, books, things like that. Mediterranean diet is a pattern-based diet it's basically what we're talking about now. DASH diet is very similar. It's a diet for high blood pressure, but has a lot of the same recommendations. Obviously, if you drink alcohol, try to do it in moderation, or at least, if you think that you drink more in moderation, then we can work on reduction there. Um, Practical tips, because all of this is hard to remember. Um, you know, Eat more foods that don't come in a package, right? If it comes in a package, it's more likely to be highly processed. Minimally processed foods typically don't come in a package. And you might have heard before, but I tell people, try to shop the outside of the grocery store, right? That's where you're going to find your fresh fruits, your vegetables. You're going to find your fresh meats, um, less processed foods. Um, if you stick to that kind of section of the store. Cooking most meals at home, that's a pretty big deal. I'm sure we've all gone out to eat and thought that we eat healthy until you see how many calories are on what you're eating. You try to eat a grilled chicken salad and you look down at the calorie count and it's 1,700 calories, because of the bacon and the cheese and the ranch or whatever else is on there. So eating out, it makes it hard to eat healthy and to lose weight or to control these risk factors. Obviously, we all want to eat out, but most meals cooked at home makes it easier to do. And then just start looking at the ingredients list. If it has a long list of ingredients, it's probably something that should be limited. All right, physical activity. This is the other part of lifestyle change, or lifestyle choices that can help minimize our risk factors, the high blood pressure, the high cholesterol, the diabetes. But what I try to point out when I talk to people is that physical inactivity by itself is a significant risk factor for cardiovascular disease. So it's a major risk factor. It's comparable to smoking, to high blood pressure, to high cholesterol. Physical inactivity is a significant risk factor. And, when you look at statistics, only about 1 in 4 adults really kind of reach the physical activity guidelines that are set out by, say, the American Heart Association. And really about 25% report no activity, no leisure time activity at all. And so we really want to concentrate on physical activity, not only to reduce our other risk factors, but because it is a risk factor in itself. Regular physical activity by itself reduces your risk of cardiovascular disease by 20 to 30%. And so that's a pretty significant risk reduction right there. It helps to lower your blood pressure. It's going to improve your cholesterol. It reduces your blood sugar, reduces inflammation. It helps strengthen the heart muscle. Obviously, it helps with maintaining weight, stress reduction. A lot of good things come from physical activity. If you want to look at the actual recommended activity, the official recommendation is going to be 150 minutes per week of moderate intensive activity. So think of that as like at least a brisk walk, right? Something that gets that heart rate up. You can feel yourself working, but it doesn't have to be vigorous. So that would be 30 minutes a day for about 5 days a week to hit that mark. If you're a runner or if you do more vigorous activity, then it's 75 minutes per week. They also recommend 2 days of strength training. It doesn't mean we have to go join a gym and spend that money. It could be body weight activities at the house. There's lots of different ways to do strength training as well, but that is definitely beneficial. You don't have to go from no activity to 150 minutes per week because it's hard to do. And you know, if anybody's like me or people that I talk to, it's we're able to make a lot of excuses on why we can't exercise, whether it's you know, my schedule, you know, I got my kids at home, we got sports. I've been there in the same shoes and I've talked and I've heard them all too. But finding practical ways to increase activity can make a big difference, whether it's trying to find time to walk on a daily basis. Even 15 minutes at a time can make a big difference. Trying to use the stairs more frequently rather than the elevator. Parking further away at the grocery store, the mall, or wherever we're at. And just taking short movement breaks, sitting for long periods of time, that's a risk factor. So just every hour, taking a movement break, walk around the building, see if that makes a difference. Going even small improvements make a large difference. So no activity to some activity is our biggest impact there. So we went all of the risk factors, and we're getting short on time for our question and answer session, but prevention is key, right? In primary care, that's what we do. We love prevention. You know, I tell people we want to prevent a heart attack rather than treat a heart attack. So quit smoking or don't smoke, right? Focus on some of the nutritional aspects that we talked about. Try to be physically active, right? Do your best to maintain a healthy weight. All this can be done in conjunction with go to a screening doctor, go to your doctor visit, go to for a wellness visit, go once a year, at least once every other year if you're healthy, and get to know what your numbers are, right? Know what your blood pressure is, know what your cholesterol is, know what your hemoglobin A1C is. How are you diabetic or pre-diabetic or is it normal? That will help you to know what you need to do to reduce your risk. And I think we got one more. I don't want to hit these in detail because we don't have time, and I think it's a little bit above the scope of today's talk. But these are 3 additional tests that can really help in certain individuals risk stratify your cardiovascular disease risk. Outside of the things we've already talked about, outside of your blood pressure and your cholesterol. The first 2 are blood tests that can be added to any blood draw, basically high sensitivity CRP, ApoB, and a lipoprotein A. They're basically taking a deeper dive into your cholesterol profile. There's good data behind these to help decide, to help you see, I guess, where your risk is. And what you can do to maximize that. Calcium score, that's actually a CT scan of your heart. It's looking at the vessels around your heart. It's looking to see if there's any calcifications in those vessels. That represents plaque or heart disease that's already there. So if I'm talking to somebody about reducing risk, minimizing risk, and what we can do, we're always discussing these tests as well on whether or not these tests are right for them. Finally, I just wanted to include this picture. You can kind of just see what a healthy artery looks like. And then as you get some atherosclerosis or plaque buildup, you can see that it obstructs the blood flow through there. Once you get obstructed blood flow, you get heart attacks. Everything we talked about today either leads to or prevents that plaque buildup. And that's the gist of coronary disease. So I know that was a lot of information in 27 minutes. I want to make sure we open it up and have any questions, comments, or anything that we need to address.
I have a question for you, Dr. Stone.
What you got?
On the calcium score, is there like a range that's good, or should it really just be 0? Just curious.
So that's a great question. It really is. And a lot of it depends on your age and your other risk factors too. So 0 is ideal, right? 0 means you are
Right.
low risk of having heart disease. We don't see anything on calcium score, and that's what we want. But yes, there's a range, and there's, and depending on what you look at, it could be 0 to 100 is low risk, 100 to 300 moderate risk, but it really depends on what else is going on with that individual as well. For example, if I have a young person, maybe they're 45 years old and they already and they have a calcium score that's above 0, I'm going to treat that person more aggressive, right?
Right.
Because we're already seeing signs of heart disease. They, at a younger age, they're going to have longer time to maximize our preventive therapies. And I'm going to be more aggressive in that person. But, it depends on the person, it depends on the age. But yes, there is a range.
Okay.
And I've seen them from 0 and I've seen 2,000, which is very high.
Wow.
So
Yeah.
Yeah.
All right. Thank you.
Sure. All right. No questions. Well, if anybody has any questions, I guess this is going to be distributed, correct?
Yeah. It'll be
and then if anybody
distributed
has
out
any,
to the clients, and they'll distribute it among their employees and stuff. Yes.
I thank everybody for coming in and listening. It's been exactly 30 minutes now.
Thank you. I
Thank
appreciate
you.
it.